You're in Saskatchewan. You have a job or you're willing to work in healthcare, whether you're a trained healthcare worker, a recent graduate, or on any work permit open to new opportunities. Are you wondering, is there actually a way I can stay here permanently? The answer is yes. It's called the SINP Health Talent Pathway. 2 tracks, strict requirements, and mistakes that can cost you everything. Stay with me. I'll explain exactly how it works. Welcome to Canada Clarity, where we break Canadian immigration without confusion. Let us start with the basics. The Health Talent Pathway is a subcategory of the Saskatchewan Immigrant Nominee Program, the SINP. It is designed specifically for internationally trained healthcare workers who have a valid job offer in Saskatchewan and intend to become permanent residents. Here is how it works. You apply to the SINP. Saskatchewan nominates you for permanent residence. You then apply to the federal government for your PR application. The nomination is your ticket. It makes your federal application much stronger and much faster. There are 2 streams inside this pathway: the non-express entry stream and the express entry stream. They have different requirements and different timelines. I will explain both. Before we get into requirements, you need to know which stream applies to you. Stream 1 is the non-express entry stream. This is the standard provincial track. You do not need an express entry profile. The minimum language score is CLB 5. It works well if you are already living and working in Saskatchewan. Home support workers under NOC 44101 are eligible under this stream. Stream 2 is the express entry stream. This requires a valid express entry profile. The minimum language score is CLB 7. The big advantage is speed. If SINP nominates you through express entry, the federal government targets your PR processing in 6 months or less. Note that NOC 44101 is not eligible under this stream. Here is the key rule. You cannot apply through both streams at the same time. Choose one based on your situation. Let us go through the non-express entry requirements one by one. You must meet every single one. Number 1. Legal status or living abroad. You must have valid immigration status in Canada or be currently living outside Canada. Refugee claimants cannot apply. Number 2. Language. Minimum CLB 5. Your test must be less than 2 years old. Number 3. Work experience. If you are in Saskatchewan, you need 6 months, 780 hours with the employer supporting your application. If you are outside Saskatchewan or Canada, you need 1 year of experience in the same occupation within the last 5 years. Number 4. Post-secondary education related to your occupation. A bachelor's degree, master's degree, 3-year university diploma, or 2-year diploma from a post-secondary institution. But here is an important exception. If you are a nurse aide, a patient service associate, a pharmacy assistant, a personal support worker, or a caregiver, any 2-year post-secondary diploma qualifies. It does not need to be related to healthcare at all. I will explain this in more detail in a dedicated slide. Number 5. If your occupation requires a license in Saskatchewan, you must be eligible for that license at the time you apply. Number 6. A permanent, full-time job offer from a SINP registered employer with an approved employer position assessment. Now, let us talk about express entry requirements. Everything in the non-express entry stream applies, plus these additional requirements. Number 1. You must have a valid express entry profile with a profile number and a job seeker validation code. Number 2. Your language score must be at least CLB 7. And your score must exactly match what you declared in your express entry profile. Number 3. You need at least 1 year of high-skilled paid work experience in an eligible occupation within the last 5 years. This can be from inside or outside Canada. Number 4. If your education is from outside Canada, you must provide an educational credential assessment from an IRCC-designated organization. The payoff for meeting these higher requirements? Federal PR processing targeted at 6 months or less. That is a significant advantage. Let us talk about language scores in detail. For non-express entry, you need a minimum of CLB 5. In IELTS general training terms, that is a score of 5.0 in each of the 4 bands. For express entry, you need a minimum of CLB 7. In IELTS general training terms, that is 6.0 in each band. 5 tests are accepted by the SINP, that is IELTS General Training. CLPIP General, Pearson PTE COR, TEF Canada, and TCF Canada. Your results must not be more than 2 years old at the time you submit. One important warning: some Saskatchewan employers and licensing bodies require scores higher than the SINP minimum. An RN licensing body may require CLB 7 even for non-express entry. Always confirm language requirements with your employer and your regulatory body before you book your test. Work experience requirements depend on your stream and your current location. Scenario 1. Non-express entry currently working in Saskatchewan. You need 6 months of full-time work, 780 hours with the specific employer supporting your application. If you have not yet worked with them for 6 months, you need 1 year of experience in the same occupation within the last 5 years. Scenario 2. Non-express entry applying from outside Saskatchewan or outside Canada. You need 1 year of paid work experience in the same occupation as the job offer within the last 5 years. Reference letters from each employer on company letterhead are required. Note that self-employment only counts toward this requirement if you are applying under a managerial NOC or a regulated occupation. Scenario 3. Express entry from inside or outside Canada. You need 1 year of high-skilled paid experience in an eligible occupation within the last 5 years. Paid co-op work terms count. Volunteer work does not. One rule applies to every scenario: all work experience must be paid. Volunteer work and unpaid placements never count. This is the step that most people miss, and missing it can end your application before it even starts. Before you can submit anything, your employer must complete 2 things. Step 0. Before you even accept the job offer, ask your employer directly: are you registered with the SINP? Do you have a certificate of registration? This is sometimes called a COR. And have you submitted or are you willing to submit an employer position assessment for my position? If they do not have a CRA yet, that is okay. They can apply for one. But this takes time. Ask early. Step 1. Your employer registers with the SINP and receives their certificate of registration, the COR. Without this, nothing else can happen. Step 2. Once registered, your employer submits an employer position assessment, also called the EPA, to the SINP for your specific job. This is one of the most critical documents in your entire application. Without a completed and approved EPA, you cannot apply. Step 3. When the EPA is conditionally approved, the SINP will send you a notification. You must log in to your Oasis account within 10 days to validate the position details. There is no approval letter from the employer. You must check it yourself in Oasis. This is critical. You have exactly 10 days. No extensions are given. Miss that window and you must start over from the beginning. Step 4. Only after you validate the EPA in Oasis can you submit your own application. The Health Talent Pathway covers over 40 health occupations. You can see the most common ones on screen right now. Pause the video and check if your occupation is listed. The ones highlighted in gold have the education exemption, meaning any 2-year post-secondary diploma qualifies, even if it is not related to healthcare. I will explain that in the next slide. If your occupation is not shown here, that does not mean you are automatically ineligible. The full list has over 40 NOC codes. Go to saskatchewan.ca/SINP and search Health Talent Pathway to see the complete and most up-to-date list of eligible occupations. Let us talk about education requirements in detail. For most occupations under this pathway, your education must be related to your health occupation. Accepted qualifications are a master's degree, a bachelor's degree, a 3-year university or college degree, or a 2-year diploma from a post-secondary institution. If your education is from outside Canada, you must include an educational credential assessment from an IRCC-designated organization. Now let us talk about the 5 exempt NOC codes. If your occupation is NOC 33101, 33102, 33103, 33109, or 44101, you do not need a related education credential. Any 2-year post-secondary diploma from a recognized institution qualifies, even if it has absolutely nothing to do with healthcare. This is a significant advantage for care aides, nurse aides, patient service associates, pharmacy assistants, and home support workers. A 2-year diploma in business, technology, education, arts, anything satisfies the requirement. Let us go through the documents you need before you submit. Number 1. Job offer letter. On company letterhead, signed, showing your title, duties, wage, hours, location, and benefits. Number 2. Validated EPA confirmed through your OASIS account. Your employer must be registered with SINP and submitted EPA before this is possible. Number 3. Language test results. Valid within 2 years. CLB 5 for non-express entry or CLB 7 for express entry. Number 4. Education credentials. Degree, diploma, and transcripts. ECA required if credentials are from outside Canada. Number 5. Work experience proof. Reference letters from each employer on company letterhead, plus one government-issued document per employer, a T4, work permit, or tax record. Number 6. Valid work permit. If currently in Canada, include a copy of your IRCC-issued work permit. Number 7. Proof of Saskatchewan residency. Your Saskatchewan Health Card or SGI driver's license if claiming Saskatchewan work experience. Number 8. Licensing proof. If your occupation is regulated in Saskatchewan, include proof of eligibility for that license. Number 9. Federal forms. You must include IMM 0008, the generic application form, IMM 5406, the additional family information form, and Schedule A, also known as IMM 5669. Let us talk about the 4 mistakes that destroy applications. Mistake number 1. Your employer has no certificate of registration and you never asked. Before you accept a job offer, ask directly, do you have a certificate of registration with the SINP? If they do not, they can apply for one. But it takes time. Ask early. Do not assume. Mistake number 2. Missing the 10-day OASIS validation window. When SINP notifies you that your EPA is conditionally approved, you have exactly 10 days to log into OASIS and validate. No exceptions, no extensions. Miss this window and you start the entire process over, including a new $500 fee. Mistake number 3. Submitting with missing or untranslated documents. Incomplete applications are not held. They are returned. A returned application cannot be reopened. You submit a brand new one and pay the fee again. Get every single document ready and reviewed before you submit. Mistake number 4. Home support workers applying for live-in positions. If your employer wants you to live in the client's home or place of employment, the Health Talent Pathway is not available to you under that arrangement. Those employers must use the Federal Home Care Worker Immigration Pilots instead. Using the wrong stream means automatic ineligibility. Let us recap everything. The SINP Health Talent Pathway is one of the strongest PR pathways for healthcare workers in Saskatchewan right now. Here is your checklist. You need a job offer in an eligible health occupation in Saskatchewan. Your employer must have a certificate of registration, the COR, with the SINP. The EPA must be submitted by your employer and validated by you in OASIS within 10 days. Your language test must meet CLB 5 for non-express entry or CLB 7 for express entry. You need work experience 6 months with your current Saskatchewan employer or 1 year in your occupation within the last 5 years. And you need related post-secondary education. Unless your NOC is 33101, 33102, 33103, 33109, or 44101, in which case any 2-year diploma qualifies. Before anything else, find out if your employer has their COR. That is step 0. Everything follows from there. Always check the latest requirements at saskatchewan.ca/SINP before you apply. Immigration rules change, and you want the most current information. If this video helped you, please like it and subscribe to Canada Clarity. Drop your questions in the comments below. I read every single one. See you in the next video.